Hello, everyone. Thank you for joining us. We are excited to have this Q&A session tonight. I hope everyone had a wonderful weekend um, and the week is going well. Go ahead and get your questions ready. Share the link with your friends. Tell them that we are live taking questions. For those of you who are joining us for the first time, like Deigni Plastic Surgery, follow us on TikTok. And get your questions ready. I'm a board certified plastic surgeon and I specialize in body contouring procedures. So that includes the mommy makeover, body lift procedures, breast surgery, breast augmentation, breast lift, fat transfer, liposuction, and my signature procedure is to drain this tummy tuck. So definitely ask your questions if you've been considering a mommy makeover or some type of plastic surgery procedure. By all means, ask your questions and I'll be happy to answer your questions and get you in for your consultation. For those of you who are out of town or out of state, we will start with a virtual consultation and you will send us pictures so that I can see the areas that you want to have improved and I can be more aware of what the potential procedures would be. And then when we meet virtually, then we can discuss that in greater detail and get your treatment plan set up. Hey, Jackie Marie, thanks for joining us. Hope all is well over there in Louisiana. All right. We're supposed to be having some rain, I think, this week, and I think it's been holding off for the most part. We might have some rain tomorrow, so we'll see. The weather has been pretty decent here in Houston. All right, so let's see here. Go ahead and ask your questions. Like I said, we're talking about plastic surgery, body contouring procedures. I'm also going to answer some of the questions that I've written based on what you guys have sent throughout the week and over the weekend. All right, December Phoenix is starting us off. What should your weight be for the body lift procedure? Very good question. Max BMI for these body contouring procedures to qualify for me is 35. So, and that's definitely one of the hot topics that you guys always ask, which is great. Let me give you some information about that. So, for example, if you're 5 foot tall, your max weight will be 179 pounds. If you're 5'2", it will be 191. If you're 5'4", your max weight will be 204 pounds. If you're 5'6", 216. If you're 5'8", 228. And if you're 5'10", 240 pounds. So that would get you a BMI of 35. So if you can definitely get those, the weight to your max BMI or even below, because the higher the BMI, the higher the risks of complications, wound healing problems, and things like that. And we want you to be able to have a wonderful and uneventful recovery and be able to enjoy the body lift or body transformations that you're having safely. So if you can get your BMI even to like a 32 or 30 or 28, that's even better. So definitely contact us and we'll be happy to answer your questions. This is our phone number, 281-724-3138. Or put in your information in the bottom left of the screen there, and we will reach out to you during the week and get you in for your consultation. Thank you. Cravens, do you prevent keloid after getting cut? So patients who are prone to having keloid scars, what we do in all my patients is a technique that helps to minimize the tension at the cut so that it decreases your chances of actually getting keloid scar. And I do that in all of my patients. Stella 6034. Can 3 times C-section go for a tummy tuck? Absolutely. Yes, that's another question. I've had patients who've had multiple C-sections, 3, 4, even 5 C-sections. And I've had some patients who've had the combination of a C-section scar that goes transverse. They've had even a hysterectomy scar, which is different than the C-section scar. I'm not sure why they didn't go in the same C-section scar. And I've had patients who've had that plus the vertical C-section scar. And they've come in for their procedures, and I've been able to give them a very nice, beautiful tummy tuck. And again, I do the drainless tummy tuck, which makes your recovery a lot faster and a lot easier. I keep the incision nice and low. For example, on this patient up here, you can see her before and after. And I did a body lift. Body lift is a combination of the drainless tummy tuck, the hip lift, and butt lift. And I always take care of the mons plasty. So the mons pubis area, the fupa area. I'll always take care of that. It's included in my drainless tummy tuck technique. For pricing for everybody, please go ahead and contact my office, 281-724-3138, or the easiest is just to put your information in the bottom left of the screen there. There should be a form where you can put in your name, phone number, email, and kind of like the procedure that you're interested in. And my patient coordinator will reach out to you and answer more questions and then get you in for a consultation so we can make sure that we are doing the right procedure for you. And then we'll get you in for your surgery. From Canada, thank you. You used your long number. I appreciate you contacting us and participating. I've had some patients from Canada as well. So we'll be happy to get you in and have you fly in to get your surgery as well. Not a problem. Same for Sophia Geneste 622. For pricing, please go ahead and contact us. Usually the price of a tummy tuck is around $13,000. It includes anesthesia facility fee, surgeon's fee, as well as your post-op care, your garments, and everything, as well as the scar cream as well. I have a particular scar cream regimen that I have my patients start about 1 month after surgery, and the pharmacy compounds that scar cream and then ships it to you. Miss Officer 2, I had a paniculectomy on March 13th. Go tubes are out. Follow up on April 30th. Okay, wonderful. Did you have a question? If you do, please let us know what your question is. But wish you well and a good recovery. Whenever I do a paniculectomy, I don't do any drains at all. I make it much easier for my patients to be able to move around and heal well. So definitely, if you're interested in moving forward with a full tummy tuck next time, definitely let us know and we'll be happy to take care of you. Again, also, Maria Merino is asking for the price. Please go ahead and contact my office, 281-724-3138, or put your information in the bottom left of the screen here. There should be a form that you can click in, put your name, phone number, email, and then what you're interested in having done. And we will reach out to you and answer your questions, get you estimates for your procedures. But again, for the drainless tummy tuck, it's usually around $13,000 is the budget that you will plan on having. And it includes anesthesia facility, surgeon's fees, as well as all your post-op care, all your appointments, and your scar treatment. Bubbles burst. Do you do lipo 360? Absolutely. I do lipo 360, and that includes liposuction of the love handles, the back, the bra line, the belly area. So pretty much the whole 360 of your torso. Yeah. And contact us, and we'll be happy to get you in for your consultation and get you in for your procedures. Stella6034, are you on Instagram? Yes, I am. I'm actually currently live on Instagram. And my Instagram handle is the same as my TikTok. It's Deigni Plastic Surgery. We also have a YouTube channel, and I'm also live on it right now. The YouTube handle is the same, Deigni Plastic Surgery. So you can find us on multiple platforms on social media, and we'll be happy to answer any questions that you have. So contact us. Phone number is 281-724-3138. Hello, Iman8680. Thank you for joining us. Skylar is saying, I have a C-section with my firstborn. Can I do it? Absolutely. So I've had patients who've had multiple C-sections before, and I'm able to remove that C-section scar. I put the tummy tuck incision nice and low so that when you're wearing a bikini or bathing suit or underwear, your tummy tuck scar is not visible. So it's very, very nicely healed and hidden, and it's really nice and thin. Okay, good. So we got a question about where do I perform this procedure? So Anne is asking, do you do this procedure in the hospital? I do not. I do it in a same-day surgery center. And so you're able to go home the same day. For all my procedures, they're same-day procedures. And I avoid the hospitals to avoid any risk of inadvertent, contamination, any other issues, because there are sick people that go to the hospital as well. So I do it in a same-day surgery center, and it's plastic surgeons that operate there on healthy patients. Brown bombshell. What do you recommend for an apron belly? A mommy makeover? It all depends on what you present with. So my recommendation is that you consult with a board-certified plastic surgeon who specializes in body contouring procedures. If you want me to be your surgeon, by all means, come in and see us. We'll be happy to examine you, and we will put together a treatment plan. At a minimum, I would say get a tummy tuck. I do the drainless tummy tuck, which makes your recovery a lot easier and smoother. I inject Exparel medication in your belly area once I've fixed the separation of muscles. And that Exparel allows you to have much better pain control and decreases the amount of pain pills that you need in your recovery. Most of my patients will wean off the pain meds within 3 to 5 days of their surgery, and they're also walking upright within that same amount of time. So by the time they come back to see me a week after surgery, they're typically walking upright, they're driving themselves to the appointment, and after that are able to go back to work fairly quickly, which is fantastic. So definitely contact us, and we'll be happy to move forward. Maria, having that surgery done at Tampa General on June 17th. Wish you well. Hope all goes well. If for in the future you would like to have surgery with us, we will be happy to have you come and see us and take care of you. We do have plenty of patients that come in from Florida as well to have surgery with us. Excuse me. Shaylee 1600. I only want a mini tummy tuck or apron removal. Is that an option? Absolutely, it is. And for patients that qualify for the mini tummy tuck or the apron removal, I do that. I offer that in the office as well. So we can do that under local anesthesia. Again, you have to qualify for it. It's not every patient that will necessarily be a good candidate for that. If you're prone to having a lot of anxiety, scared of needles, and you won't feel comfortable being awake while we do this procedure, then you might not be a good candidate for that. But if those things don't bother you, we'll be happy to do it under local anesthesia in the office. It will definitely decrease the amount that you have to pay. Thank you very much for the roses. Because you won't have to pay for the general anesthesia fees and the facility fees. So contact us, 281-724-3138, or easiest, put your information in the form on the bottom left of the screen, and we will be happy to take care of you. All right, let's see here. Okay, so use your long number. What kind of liposuction? Liposuction, I do the power-assisted liposuction with the micro air machine, and I perform liposuction anywhere on your body where you have some excess fat pockets that bother you, so that we can actually contour it better. Vavavoom, that's a cool username. I just had a tummy tuck and lipo 2 weeks post-op, and I still feel so stiff when I get up from sitting. Okay, definitely contact your surgeon and make sure that you are healing well and follow their post-op care instructions. 2 weeks is probably still early in the game, especially if you haven't had the drainless tummy tuck. because with drains in, you might be at a point where they've removed your drains. It depends. Everybody's different. Some people will have the drains in for 2 to 3 weeks. So definitely follow up with your surgeon and make sure that they are taking care of you and are not missing anything. But 2 weeks is still early in the recovery phase. But for my drainless techniques, definitely you're able to actually move a lot faster than the traditional technique. Slim CJ1, how many years in the body lift? I'm not sure what you mean by how many years in the body lift. Can you rephrase that question so I understand what you're getting at? Thank you. Heather Marie, what about someone who has had an old-fashioned gallbladder removal? Very good question. Would they, I'm guessing, probably say be a candidate? Yes, will they be a candidate? Typically, yes. So I've operated on patients who've had that scar on the bottom right of their belly area. It could be also be for the appendix or gallbladder. But most of the time, yes, you're a candidate. I have some patients that I've operated on who've had that old school traditional technique or old fashioned gallbladder removal, and they've done very well. So come in and see us. Again, it all depends on where your scar is, what your body is like, where the excess fat and tissues are. And on examination, when I see you in the office, I'm able to actually determine how things are moving and what level of risk we're facing. Queen Queen Ashi, yes, she's saying I would have to come to Texas. Yes, I'm in Houston, Texas, and we would be happy to take care of you. We have patients that come in from all over the U.S., so they'll drive in or fly in from outside of Texas to come and have surgery with us. So please go ahead and put your information in the bottom left of the screen there. We'll be happy to take care of you. All right, let me see here. Valerina87 has joined us on Instagram and is saying, I will be seeing you in July for my arm lift and broad lift surgery. Will I have drains? Great questions. No, you will not have drains with those procedures. Again, I use this drainless technique and philosophy for all of my procedures, for all of my body contouring procedures. The only time that I may place a drain is if I'm doing a brow lift to really help to remove any fluid that could accumulate here in the forehead area, or maybe like a neck lift, because it's not as easy for us to actually put those stitches to close the space down. But otherwise, for the arm lift, brow line lift, breast, body lift, thigh lift, procedures during this tummy tuck, I don't place drains. So you'll be able to recover nicely without having to worry about drains. Great. Let's see here. Let me get to the questions. Fantastic. If I missed your question tonight, please go ahead and repost it. I will try to get to it. And I appreciate everybody's patience. Roxy Creations, is there a way to get a BBL if I'm anemic? Absolutely, there is. Most patients have iron deficiency anemia. So we need to make sure that you get good iron supplementation to boost up your hemoglobin levels and get them to a more normal range. I've operated on patients who've had anemia before, and it may take several months for your body to get those hemoglobin levels back to normal, but it can be done. And so once you get it there, then we're able to do the combination of the liposuction and the fat transfer for the BBL. So definitely put in your information in the bottom left of the screen there. We will be happy to answer your questions and take care of you. Thank you very much for the rose there, Margie. I appreciate that. Let's see here. Let's see, where are we? Okay. Next question. Brown Bombshell is saying, thank you. I lost nearly 90 pounds. Congratulations on the weight loss. Have more to lose. Okay. A lot of loose skin and seeking mommy makeover and lipo 360. Okay, good. So with a lot of skin, yes, you would need what I would recommend definitely is kind of like a body lift, where I actually tackle all of the excess skin, not only in the belly area, but also on the sides. So you can see how there's a lot of sagging, for example, on this before picture. And then with the body lift, this is without liposuction, without fat transfer. It's just skin excision procedures. I'm able to give her a very beautiful contour with the hip love handles as if she had had some type of liposuction or BBL, but no, it's not. But for some patients, we can even combine that on top of the body lift. So with the excess loose skin, I'm pretty sure you will want to have that skin excision procedure. So the body lift plus the liposuction if you want, and maybe some fat transfer in areas where there's some loss of volume. Thank you very much for your questions. I appreciate it. And let's see here. We've got a couple more questions, and I'll try to get to all of them tonight. Slim CJ, how many years as a body lift doctor? How many years as a doctor? Oh, how many years have I been practicing? I've been practicing. I finished my residency training in 2016. So that's what, 9 years now. So I've been practicing for 9 years now, and I do body lift procedures all the time. That's part of my standard body contouring procedures. Thank you for your question. And I do all of these procedures drainless, so you don't have to have drains for these procedures as long as you do the technique well. Okay, let me get to the questions here. For anybody who's got questions, so I see Neo Queen is asking about the cost for tummy tuck. Any questions about cost of these procedures, please go ahead and contact our office. But for the drainless tummy tuck, it's typically around $13,000. That includes anesthesia fees, facility fees, and surgeon fees. It also includes all of your post-op appointments, and I'll see you 5 times during the course of 6 months. And I also include scar cream treatment for all of my patients that are getting these body contouring procedures. So definitely contact us and we will be happy to take care of you. All right, so I see that we've got quite a lot of questions and I'll try to get to them as fast as possible, okay? Thank you for your patience. And I see some of them have been repeated. I totally understand. Okay, so Slim CJ was asking, how long have you been doing it? Do you need a certain BMI? Yes, max BMI of 35. What is the vasolipo? So user numbers is asking, what is the vasolipo? So vasolipo is a liposuction that uses ultrasound energy to heat up the fat, and then you do the suctioning. I don't use vasolipo. I use power-assisted lipo. Hey, Tropical Exotic Treats, thank you for joining us and thank you for the gifts. I appreciate it. I use power-assisted liposuction with the micro air technique. And what you want to do is make sure that you go to somebody who's well-trained and who does very good work and you're pleased with their before and after pictures. So because it does take time to learn certain techniques. And so absolutely ask your questions and definitely get your patient, your doctor to be able to answer your questions. Elisa Montag is saying, I like the before and after. Oh, thank you very much. Oh, you like the before better. I wonder why. She's got a much nicer body on the after. There's a lot of loose skin that you may not be able to see just because it's just one view, but a lot of loose skin and a overhanging belly that she does not have in the after. So her after is a lot prettier and much better than the before. Okay, so let's see here. Let me get to these questions. What about someone who's had an old-fashioned one? Yep, I answered that. Lost 90 pounds. What is a mini tummy tuck? So the mini tummy tuck is a procedure for certain patients that want to get that lower belly apron removed and don't need the repair of the diastasis recti, so the repair of the separation of muscles. We don't move the belly button. We fix the small area of overhang on the bottom part of the belly. And so not everybody qualifies for that. And that is something that we do in office with patients awake. Again, it all depends on the patient and if they're actually able to withstand being awake for these procedures. So pricing, like I said, is $13,000 on average. So that's what you want to budget, and it includes anesthesia fees, facility fees, and surgeon's fees. And it's a drainless tummy tuck, makes your recovery a lot easier, a lot faster, so that you can actually go back to work usually within 1 to 2 weeks easily. Diana 359 is asking, do you take insurance? We do not take insurance. All of our patients pay out of pocket, and we do offer financing options for that. We offer Care Credit, Alpheon, Cherry Financing, and what's the fourth one? Patient Fi. Patient Fi is our fourth one. But definitely contact us, and we'll be happy to get you in for your consultation and get you for your procedures. Let's see here. BMI. So BMI, old grandma's asking for BMI. BMI, OG grandma. Max BMI is 35. Tammy is saying, have you heard of laser lipo? Yes. So that's some patients, some practitioners, plastic surgeons will use lasers to help melt the fat, and then they'll proceed with the liposuction. I don't. I use the power-assisted liposuction technique, which breaks up the fat. The cannula vibrates and breaks up the fat. Crystal is asking, let's see, what about lymphedema lipo? Do you take insurance? We don't take insurance, and we don't do lymphedema lipo. What I recommend is that you find a center who specializes in lymphedema liposuction, and they should be able to take care of you. Simon, should I get lipo before the body lift? Typically, I would want you to do your liposuction along with your body lift, or get it after, because if you get liposuction before, so you need a body lift, right? So you've got a lot of loose skin. If you do liposuction before, you're going to get even more loose skin, but then you're going to scar down. When you scar down and you want to come in for your body lift, it's harder to pull those tissues and pull it nice and tight because of the scar tissue that's already formed from the liposuction. So typically, I would want you to do the body lift, and then you can come back in and get your liposuction if you don't want to combine them at the same time. Maria, do you do folliculectomies? We do. A lot of our patients who qualify will actually benefit more from the full tummy tuck. So, but definitely if you want just a paniculectomy, I do perform those. I do not take insurance. Most insurances will typically cover the cost of a paniculectomy. Of course, you have to jump through a lot of hoops, and but if you're able to get that approved, then the insurance will cover it. But I don't take insurance. When I do the paniculectomies, my patients pay out of pocket. Now, quick question by Valerina87. Thank you very much for your patience. One more question. Will I need lymphatic massages? For a jointless tummy tuck, you do not need lymphatic massages. If we're combining, for you, you're going to be doing arm lift and bra line lift. You'll probably, yes, for the arm lift, because for the arm lift, what I do typically is a combination of liposuction with the skin excision. I typically will have you get some lymphatic drainage treatments on the arms where I did the liposuction as well. So yes, I think you will benefit from that. Absolutely. Price for a body lift and a drainless tummy tuck, Tina P. For pricing, please contact us. I mean, pricing, like I said, for just the drainless tummy tuck is $13,000, and it includes facility fee, anesthesia fee, surgeon's fees, as well as your post-op care, your garments, and your pre-op kit, as well as your scar treatment. And for any other procedures, I don't know the pricing, but definitely contact us, and we'll be happy to get you in any mommy makeovers. People, who want to add many. Hello, Rosa Rocha. Grafina, nice to see you. I hope all is well with your family. Definitely contact us, and we will be able to get you some estimates. But these body contouring procedures and mommy makeovers can range anywhere from $15,000 to $25,000, depending on all the procedures that you put in together. So definitely let us know. So Shadow 8612, can you please tell me if I'm a candidate? I suffer from hyperterrorism. I think you mean hyperthyroidism. So we definitely need to make sure that your thyroid is appropriately treated. So your endocrinologist should be able to manage that. And once that's appropriately managed, then we can go ahead and move forward with surgery. I've operated on patients who've had problems with the thyroid before, but they're medically optimized for surgery. So if we can do that, then we can get that done for you. From New York to LA, Vanessa, what about removing fat from the neck? Yes, we can remove fat from the neck. It all depends on how much you have, what else needs to be done. We can definitely do that. Missini is asking what part of Houston. My office is in the River Oaks Galleria area, so within the 610 loop. All right. Shauna Unfiltered. I'm from Oklahoma, but after losing 150 pounds, I need this. We'll be happy to take care of you. Congratulations on your weight loss. I really love doing these procedures on patients, especially who've had massive weight loss, because it transforms their life. It's not just doing beautiful surgery. It actually affects every area of their life, and it boosts their confidence. It really opens up their ability to socialize even more. And I see that in my patients, and they're the ones who actually tell me that, because I know, when you're in medicine and you're training and you're going through residency and everything, you're focusing on the surgeries. You're really working on that. And so now that I'm actually practicing, and I've been in practice for 9 years, and doing these procedures, when I hear what my patients tell me after, I really see the impact that the surgeries have on them, how it affects their the quality of life, their interactions with others, the way they carry themselves at work, the things that they're actually able to engage in. It's fantastic. It's amazing. And I've tried to capture some of that in my patient testimonials, and we started a YouTube channel to get feedback and answers to questions for my patients who've gone through the process and get their testimonial. So please go ahead and also check out YouTube channel. It's Deigni Plastic Surgery. And also we posted on TikTok, questions in the interviews, pretty much what drove them to have plastic surgery, how the process was, would they do it again? What did they like about the process and things like that? So it's really, really nice. Linda Tamishi, I'm not sure how to pronounce that. 7. Do you do BBL? Absolutely. We do the BBLs, and we'll be happy to take care of you. So put in your information in the bottom left of the screen there, and we'll reach out to you and take care of you. Porsche Green Jay, thank you very much for joining us. Okay, Tammy DH. Would it be okay to get procedures done if I had an umbilical hernia before? You mean a repair? As long as it's been repaired, absolutely. I've operated on patients who've had umbilical hernia repairs done with mesh placement and everything. I've done that on them before, and they've had beautiful results with beautiful tummy tucks, drainless tummy tucks, body lifts, and things like that. Definitely, we can do that. Hello, Candace Young. Thank you very much for joining us. I appreciate it. Purple Butterfly 43. What are the procedures for... Oh, the question just disappeared. I'm not sure why. Let me see if I can find it again. I'm not sure why TikTok bumped the question out. Okay, so MZ Bald and Beautiful. Ms. Bald and Beautiful, what is the cost of the drainless tummy tuck? Average is $13,000, and that includes anesthesia fee, surgeon's fee, facility fees, all your post-op care, your post-op garments, as well as your scar cream treatments. And I'll see you 5 times within the 6-month period after surgery, and that is all included. You don't have to pay extra for that. Let's see. How much is that? Again, for pricing, please go ahead and contact us. Put in your information in the bottom left of the screen, and we'll be happy to reach out to you and give you estimates. Everybody's different, but like I said, the drainage tummy tuck starts at $13,000. If you got a body lift, it's going to be more because we have to do the hip lift and butt lift. If you want to add breasts, so for a full mommy makeover, breast lift or breast augmentation with fat transfer, a lot of women want natural results. They don't want to go very big. they want beautiful natural results, and they prefer to have their fat transfer there. So we can do that, and that's going to build on the standard price of the drainage tummy tuck. So it could go anywhere from $15,000 to $25,000 or more, depending on all the procedures that you put in. But everybody's different. Okay, so wonderful. Thank you very much. So what are the procedures for the anesthesia? I'm not sure what you mean by that. The body lift and these big procedures, we do them under general anesthesia. And the type of anesthesia that we use is called total intravenous anesthesia. It decreases your risk of nausea and vomiting and allows you to wake up smoother and have a more comfortable recovery. Nabi318 is asking, is this life-threatening? No, this is not life-threatening. There are risks associated with doing surgery, absolutely. So that's why you want to make sure that you go to a board-certified plastic surgeon who trained in these procedures and does, thank you very much, Angela, and who is, like I said, board-certified by the American Board of Plastic Surgery and does these procedures safely. Mary Sicer is asking, can you do liposuction again after 10 years on the same area? It depends on how much fat you have. If you've accumulated some more fat, yes, we can do liposuction again. I've operated on patients who've had liposuction previously, and some of them actually have 2 rounds of liposuction before coming to see me. So yes, we can do it. It all depends on what you present with, and we'll be happy to take care of you. Ethiopia, why are these questions disappearing? Ethiopia 92. What about age? Great question. So age is not really a restriction for our patients. The main thing that I look at is your overall health. So if you are healthy enough, thank you for joining us on YouTube. I appreciate that. Ask your questions, post your question on the chat here, and I'll answer it. As long as you're healthy enough to undergo general anesthesia, we will be able to move forward with these procedures. So age is not really a problem. I've operated on patients in their 50s, 60s, and 70s, and they have done very well. One of the patients that I've operated on, she's probably about 2 years out now. She was 72 when I operated on her, and I did a full body lift. Beautiful results. Very happy, very pleased with the results. So she's now in her mid-70s, and she is doing extremely well. Lilia Hope, do you use hyperbaric oxygen therapy in recovery? I do not, but that's definitely something that can be used to enhance perfusion to the tissues and improve healing. But no, I do not use hyperbaric oxygen therapy. Okay, great question by Sean. Sean Unfiltered. If I'm coming from Oklahoma, how long would I need to stay down there for a loose skin removal? So for all of our patients that travel from out of state, even out of country, you will typically stay in Houston for about a week, anywhere between 5 to 7 days. That's typically the length of stay for all of my patients, whether they come from Florida, Northeast, West Coast, or even out of the country. So you'll come in, we will plan around your surgery day. You'll come typically 1 or 2 days before your surgery. I'll see you in the office. We'll do the markings, or at least go over the procedure. We will take pictures, sign the consents, make sure that you have all your post-op medications, and then we'll do the surgery. And usually within 3 to 5 days, you'll be back in the office so I can see you, and then you'll be able to head back home. Joyce asking, if a woman has a hernia, will she be disqualified? So if you have a known hernia, we would want you to get that fixed before. And typically, any kind of ventral hernia, umbilical hernia should typically be covered by your insurance. And so we will have you go to a general surgeon to get that fixed, and then you come back and we can do your procedures. If you know that you have a hernia, we typically would not want to proceed with any kind of liposuction without having that hernia fixed. We don't want to make you at risk, put you at risk of bowel injury and problems. Okay, so I think I answered this question, Lucy and me. What about age? Is 50 too high? No, 50 is not too high. I have plenty of patients. The majority of my patients are in their I guess, 30s to mid 50s, and I've operated on patients in their 60s and 70s as well, and they've done very well. Like I said, the majority of my patients are in that age range, but it's not how old you are, it's how healthy you are. As long as you're healthy enough to undergo these procedures, we will be happy to move forward and take care of you. Tufan is asking, do you take insurance? No, we do not. All our patients pay out of pocket. Thank you very much. Let's see, where did I leave off? Have you operated on patients, on someone with blood clots, DVTs before? I've told I can't. I have operated on patients who've had DVTs before. It all depends on what the cause of your DVT is, how far from it. You know, it's on a case by case basis. So definitely contact us, and we'll be happy to see you and explore more. Okay, so pricing, nickel, a long number, how much for hip lift and butt lift? Please contact us and we'll be happy to give you some estimates. My patient coordinator, Linda, will be able to give you some estimates. Sandra Moore, 8745. Does your stomach come back after a while? I'm not sure what you mean by your stomach come back. Does it come back after a while? You mean, do you put on fat after these procedures? If so, the main reason, hopefully, that you're doing this is, one, to get beautiful results and then maintain them long term. That's one of the reasons also that I want you to have your BMI less than 35 to be able to actually maintain longer term results. If your BMI is not controlled and you actually gain weight, then yes, you will put weight on and probably put on some weight and fat in those areas, and unfortunately ruin those results. Yeah. Oh, thank you very much, Georgia, for answering the question. I appreciate you helping me. There's a lot of questions, so it's a little overwhelming trying to get through all these questions, and TikTok just keeps pushing these questions away. So is it safe for someone with a history of DVT to get a mommy makeover? Selena V. So again, it all depends on how far out from your DVT you are, what was the cause of that DVT, what medications are you taking right now, how was it resolved, and things like that. So I've operated on patients who've had history of DVTs. They've done extremely well, but it all depends on those specifics. So contact us and we'll be happy to discuss that further and take care of you. Johnny Rogers 05, what is the age limit? Great, I answered that question. There's no age limit. As long as you're healthy enough, we can definitely take care of you. Okay, Ebony Yvette Robinson, same question. Do you have an age cutoff for your patients? No, I do not. Okay, Tracy is asking, what is the drainless tummy tuck? What does that mean? So the drainless tummy tuck is a technique that I use to actually give you a beautiful tummy tuck result. The traditional tummy tuck, you have two drains, usually one or two drains when you finish, because that area where we operated is all open. I actually close all of that meticulously during surgery. I put stitches there that are absorbable, that are going to actually dissolve, usually within 6 to 9 months, they're all gone. But that gives you a much nicer recovery because you're able to actually walk upright within 1 week. Within 3 to 5 days, the majority of my patients are walking upright. If they're not walking upright, it's because they're scared and they don't want to pop anything, but theoretically, you're able to walk upright. So when they come in to see me in the office and I see them walking like this, I immediately put them upright and reassure them that you'll be fine. You're not going to pop anything. This is the technique. You'll be fine. And they walk upright. So that's what the drainless tummy tuck is. So I fix all of that and you don't have any drain. So you don't have to worry about stripping them falling off too soon and then developing a seroma and things like that. It really helps your recovery to make it much easier. Couldn't pin the comment. Why? I'm not sure why. I'm having some issues with TikTok here, but let me just keep answering these questions. Shay is asking, hi, where do you cut on the arm for the arm lift? Oh, very good question. For the most part, patients come in, they have a lot of excess skin and fat in this area that goes from the elbow to the armpit. So the scar goes from the elbow to the armpit. Very rarely will I have somebody who has just a little bit of skin, loose skin, and excess fat that's bothering them. That's just right here, in which case I'll keep the incision in the armpit. But for the majority of patients, it's from the elbow to the armpit. Kiss my grits. I just made an appointment. Wonderful. Very happy. We'll be happy to take care of you. Um, Betty Guerrero also asked that. Where do you cut on the arm lift? Same question as Shea. So I just answered there. Very good. Joy, can you show a lateral view of the buttock lift before and after? I don't have it on my TikTok, and I don't think I have it here, but I have posted her pictures on TikTok. So just go to my TikTok content, and you should be able to see those pictures. And yeah, so I've posted them on TikTok, so you'll be able to see the lateral views and also the side, the quarter view side. Okay, so Purple Butterflies 43 was asking, how do you give anesthesia? Okay, so again, the anesthesia is given through the IV for all of these procedures. The type of anesthesia that I do is total intravenous anesthesia. So you get your anesthesia through the IV. What form of payment? Nephew Baby is asking, what form of payments? Form of payment, it will be cash or money order, or in financing options if you want to have financing with Care Credit, Patient Fi, Alpheon, or Cherry financing. All right, let's see. We've got a couple more questions. I'm diabetic. My A1C is 10.9. Would that be a problem? Yes, Marie Moreau. With a A1C of 10.9, your A1C, your blood sugar is not controlled at all. So one, you need to get a doctor to control your A1C. If you're actually seeing a doctor right now and they're saying that your A1C is controlled, find a different doctor. That doctor is not doing their job. Your A1C needs to be 7 or less, whether you're getting surgery or not. An A1C of 10.9 is uncontrolled glucose. So you will have issues if you stay at 10.9. It will affect all your organs. It will affect your nerves. And so you definitely don't want to stay at that. We got a comment by, I couldn't pin it. Okay. NR Selena is saying better go to Mexico. You're free to go wherever you want. I definitely do not recommend going to Mexico. We have had plenty of patients who've come in for revisions who've gone to Mexico before. We've had stories where patients have come in and said that some of their friends or even family members, unfortunately, have died in Mexico. So I'm not saying that there aren't good plastic surgeons in Mexico. Absolutely, there are. But you may not know them and you may not be going to them. And there's probably far more less good plastic surgeons that you'll probably end up in Mexico than you would care for. So definitely do your research. You're free to go wherever you want. I recommend a board certified plastic surgeon in the US, and do not price shop for your procedures. You pay what you get. So definitely make sure you put in the work. Find somebody who is board certified, who is trained, who is safe, and who cares about you. Those are my recommendations. In the end, it is your body, and you're welcome to go wherever you want to. There's tons of plastic surgeons in the world, but that's my 2 cents. Do you have an age cutoff? No, I do not. My patients, like I said, I've operating patients on patients who are in the 50s, 60s, and 70s, and they've done extremely well. So it all depends on your overall health. Abby, I have flabby thighs, but I'm not overweight. What procedure would get rid of the flab and loose skin? Without seeing you, I think you would want a thigh lift. That's what would get rid of that flabby skin and excess fat. We'll be happy to have you come in so I can examine you and make sure that that is the appropriate treatment that would be able to get you the results that you want. So putting your information in the bottom left of the screen there, and we will be happy to reach out to you and get you in for your consultation. Glam Smiles. What if you're coming from another state, and how long would you generally be there? Oh, perfect. We get patients that come in from all over the US. So typically you'll stay for about a week. After you, so that includes you coming in before surgery, usually a day or two before surgery. You get your surgery, stay usually for about 5 days. So that whole time frame usually is around a week. And then I'll see you in the office, and you can go home. Strawberry Kuka. I want to get liposuction on my stomach area, but I'm so scared of anesthesia. Okay, understandable. We will be um, um, opening up soon. We haven't started yet, but soon we'll be able to offer liposuction of limited areas awake. Um, but if it all depends on what amount of fat you have, how to contour it, and things like that. So we want to make sure that it's safe, one, and then be able to get you beautiful results. The majority of my patients, like I said, get their procedures under general anesthesia. As long as you're healthy, and we've had patients who come in who are scared of being under and all that. And some of them are actually on the feed right now and following. They're probably about 3 to 6 months out from their surgery. But when they came in, they were afraid of general anesthesia, afraid of the recovery process, but they got through it and did extremely well. So we will be happy to have you come in for a consultation. We'll take a look at you, answer all your questions, figure out what's the best treatment for you, and then we'll be able to move forward. Okay. User log number. Can a person with fibromyalgia have a procedure? Yes, but it doesn't necessarily mean that the fibromyalgia will be any better. But definitely you can. Thank you for your advice. Compression garment has helped my swelling. You're very welcome. It's tea to you. I'm very, very happy that you're able to get that. Renisha Singh, how many procedures can you do at one time? Great question. So the way I actually stage the procedures is to be able to get you the maximum results within about a 6-hour time frame. So in different patients, it will mean different procedures, but typically we're able to do, for example, for a mommy makeover, we're able to do a lipo 360, a BBL, and drainless tummy tuck, and some type of breast surgery, usually like a breast lift. So that's something that we can definitely do. But again, it all depends. Okay, Glam Smiles, again, asking about coming from out of state, like California, how long would you be here? Usually you'll be here for about 5 to 7 days. How much pricing? Please go ahead and put your information in the bottom left of the screen. My patient coordinator, Linda, will be happy to reach out to you and answer your questions and get you in for your consultations and procedures. For the drainless tummy tuck, typically average price is around $13,000. It includes anesthesia fees, surgeon's fees, facility fees, your pre-op and post-op kits, your compression garments, and your scar treatments. How long should you prepare before surgery? Yeezy Gang 24, great question. It all depends on what surgeries you're having done. If you're a smoker, you definitely have to quit smoking 4 weeks before. If you're anemic or any kind of medical conditions that you might have, we need to make sure that they're medically optimized. So it could take some time. Some patients who are anemic, it may take them maybe 2 to 3 months to get their hemoglobin levels up to where we want them. If you are diabetic, say for example, that person who said that their A1C is 10.9, it may take her 5 to 6 months to get that A1C down to 7 before we can move forward. So it all depends on what your medical conditions are. What does a full body makeover cover body areas? Angela, great question. It is very dependent on the particular patient. So in some patients, it could be, like I said, a hip lift, butt lift, drainless tummy tuck, monsplasty, so the FUPA area, breast lift and breast implants, or breast fat transfer and lipo 360. So it all depends on what you are. And some patients may actually include the arm lift. That will be a total body make. Will it be done? And also thigh lift. Will that be done all in one surgery? No, it's too much surgery and too much healing to ask of your body to do all of those procedures in one. But definitely we'll be happy to take care of that. You lost 110 pounds. Congratulations on your weight loss. We will be happy to take care of you. Please go ahead and put your information in the bottom left of the screen. Come in for your consultation. If you're out of town, out of state, we will start with a virtual consultation, and we will be happy to get you in for your procedures. We do have plenty of patients that come in from all over the US, and it's always nice to see you in person and be able to associate your TikTok name or Instagram handle to a face. Boss Man Drika is asking, can you do multiple invasive procedures? Yes, you can. You can combine multiple procedures. It all depends on what you want to have done. So for example, like I said, a mommy makeover can include lipo 360, BBL, tummy tuck, and breast augmentation with implants or fat transfer. We can definitely do that. Do you do thigh lift? Ebony Yvette Robinson. Yes, I do. I do thigh lifts, and I really appreciate and enjoy doing those. Dragon Garden, does the $13,000 include upper and lower tummy belly? Absolutely. I do the full tummy tuck that I treat. So it includes treating the upper belly, treating the separation of muscles, treating the lower belly as well, removing your belly button and repositioning it and making it look nice and cute. And then also taking care of the fupa area and the mons pubis area. What about the hip dips? Stella and Bikini. Hip dips can definitely be taken care of. Usually for that, oh, what is this? All right, I need to let TikTok know that we are still moving forward and live here. So good. So then let me continue. So the hip dips, absolutely. So for hip dips, what I do is typically we'll treat those with your own fat. So I'll do some liposuction, usually a lipo 360 to grab fat from the love handles, the back, the bra line, the belly area, and the mons pubis area to contour that. So you get a 2-in-1. And then I use that fat to transfer it to the hip dips to give you some very nice contours. Leo Queen is asking, do you do gastric sleeve? I do not. I'm not a bariatric surgeon. I'm a plastic surgeon that specializes in body contouring procedures. So I work on patients who've had bariatric surgery who now want to get their body contoured. Very good. D. Laven 11. I had a BBL on Lipo 360. Can I get a tummy tuck? Yes, you can. Absolutely. I've operated on patients who've had the BBL on Lipo 360 before and who want tummy tucks now. So definitely come in and see us. Put in your information in the form there, and we'll be happy to take care of you. Princess 23. Do you fix private parts also? Yes, I do. I do vaginoplasty, labiaplasty, perineoplasty. So for some women who've had children, multiple children, and have given birth in the natural way, they may unfortunately sustain tears in those areas. And sometimes, unfortunately, the gynecologist may not completely repair them or repair them adequately. So you may be left with some tears or scar tissue or difficulties that need to be fixed. So yes, I also do those. So definitely contact us and we'll be happy to take care of you. Keloid skin, user long number. So for patients who develop keloid scars, there are ways that we can treat them. Keloid scarring is difficult to treat. There's a high rate of recurrence, but typically will include skin excision. So the scar excision, some type of steroid injection, and then plus or minus radiation therapy or some pressure therapy. It depends on where your keloid is. But if you're saying that you're prone to having keloids, we can still do your tummy tuck or your breast surgery. It is not 100% guaranteed that you will develop keloids. Most patients don't develop any of those keloids. Let's see. Kyra 601. Do you operate on someone that has real bad internal scar tissue? I have. I've operated on patients who had multiple abdominal procedures, who have a lot of scarring. But again, now, when you talk about internal scar tissue, there's scar tissue where I operate. So for example, for tummy tuck is between the skin and the muscle, what we call the subcutaneous space as well. Anything deep to it is more like your internal organs. So your belly organs, so your intestines, your bladder, your uterus, ovaries, kidneys, all of that stuff is below that muscle layer. I don't go down there. And a lot of patients may have some scar tissue, like adhesions is what they'll call it, from internal surgery. I don't deal with that and I don't operate on that. I operate on the skin, fat, and just above the muscle area. So if you have scar there, and I've seen patients with multiple scars there, especially if they've had multiple C-sections, hysterectomies, or any type of abdominal surgery like hernia repairs, gallbladder removal, you name it. Yes, but I take my time. I remove the scar tissue, give you a nice contour, and then be able to give you a beautiful tummy. Miss Her. Is the body lift extensive and how long is the healing time? So please contact my my office. Put in your form, your information in the form in the bottom left there. We'll be able to reach out to you and give you more information as far as like the budget for that. I don't have the budget on me. The only procedure I know of is the drainage tummy tuck, which is on average $13,000. So the hip lift and butt lift added to the drainage tummy tuck, so it'll be a little bit more than that. But we'll be happy to give you an estimate. The healing time for the body lift, my patients tend to heal fairly quickly. Like I said, I do a drainage technique. So usually within 5 to 7 days, you're definitely walking upright. You're weaned off your pain meds. And typically within that first week to second week after surgery, you're back at work. Not doing any type of heavy duty lifting or things like that. That'll take a little bit longer, but desk job, remote work, definitely you can expect to be able to go back to work usually within those first 2 weeks after surgery. Everybody heals differently, of course, but on average, that's what it is. Barbara Ross, my BMI is 24 and I had the old gallbladder surgery. Can I get a tummy tuck? Great question. I would have to see you. I think you can definitely get a tummy tuck, but it all depends on where your scar is, what it looks like, how long ago you had it done. And but we'll be happy to take care of you. Come in and see us. Put in your information in the bottom left of the screen there, and we'll be happy to answer your questions and move forward. Do you help with diastasis recti? Amanel. Yes, I do. I fixed the diastasis recti on all my patients who need it when I do the drainage tummy tuck. So definitely when I do the drainage tummy tuck, I'm able to actually measure the distance between your rectus abdominis muscles, and then I fix it. The majority of patients have it pretty far out. So I'll go ahead and fix that. Marolio, the muscle sutures also dissolve. No, so my technique, I do the muscle repair with permanent sutures to keep them permanently in a good position. Very good question. Some plastic surgeons will use dissolvable sutures for the muscle repair, but I don't. I need to make an appointment for a consultation. Quiet storm. Perfect. Either put in your information in the bottom left of the screen there, or contact us 281-724-313, and we will be happy to get you in for your consultation. Okay, we had a question about, is the surgery recommended if you're on GLP-1 medication? So I operate on patients who are on GLP-1 medication. We just make sure that you stop your GLP-1 medication 3 to 4 weeks before your surgery. And that is to help empty out your stomach completely so that we reduce the amount of the risk of complications. 888, what about water retention? So some patients will have some water retention with these big procedures. We definitely want to make sure that you're well hydrated, so you have to drink plenty of water. The way you monitor that is to make sure that when you go and urinate, you go to the bathroom, your urine is clear. If it's dark yellow, you're not drinking enough. As far as like keeping that water on, there's a period of time where you will go with some swelling and water retention. So we want to make sure that you get good compression stockings, elevation of the areas where you've got some swelling, and compression garments to help treat that swelling. Suddenly, I have hangover skin when I sit, but not a lot when I stand. Do I need muscle repair, mini tuck, or regular? Very good question. I can't answer that without examining you. So I would have to have you come in to the office so that I can see you. And have a better idea of what exactly you need. Very good question. I thought the drain was to drain the fluid. 888. So yes, good question. Okay, I see what you're saying about water retention. 888. I understand your question now. So she's referring to, for example, a possible seroma formation, so fluid retention or fluid formation in the area where we do the surgery. So that's the benefit of the drainless tummy tuck technique that I use. This area where we operate on, if you do the traditional technique, all of that is open space. So you put drains in because the fluid is going to naturally accumulate. Because I do a drainage technique where I actually put multiple sutures all the way around to tack that skin down and close that space. Otherwise, usually it's open like this, and then you put the drains in between so that it drains that fluid that's going to accumulate. I actually tack it down. So there's really virtually no space for the fluid to accumulate, and your body's able to heal immediately. So that's the advantage of doing the drainage technique that I do. Do you accept care credit? Yes, I do. We accept care credit, patient fi, Alpheon, and cherry financing. Is there any charge for the first consultation? Plugwell 27. Yes. To book your appointment is $150, whether it's virtual or in person. How much is a tummy tuck? Mariam Garba. It's on average $13,000. What is the best to get after having 4 kids? Melinda McKinney. It all depends on what you present with. But after having 4 kids, I think probably at least during this tummy tuck is what you'll want, because that's going to help to fix the separation of muscles. It will also help to improve the fupa area, so the fatty upper pelvic area, or the mons area, and it will give you a very nice flat belly. Miu509, sorry, I just got here. No worries. Ask your questions. Thank you very much, Jackie Marie. She's saying, y'all better call him and get your surgery scheduled. Absolutely, definitely. Okay, so I've answered the questions. I see a lot of repeat questions. Sorry, it takes a while for me to get to them. There are quite a few questions. How much for the body lift? Please go ahead and contact us, and we will give you some estimates on how much the price of the body lift is. The average price for a drainage tummy tuck is $13,000. So you'll have to add on the hip lift and butt lift to do the full body lift. So it's going to be more than the $13,000, but we'll be able to give you an estimate. Linda has those numbers. That's the chosen one. Thank you for your question. Margaret Hadel B7. How do you fix a fupa? Oh, good question. It all depends on what your fupa presents with. Most of my patients, they have a little bit of excess fat and some loose skin. So when I do the tummy tuck, I actually lift the fupa area. So I dissect, I do surgery. I remove some of that fatty layer to contour it and make it much more even with the top of the belly area. And then I stitch it down to close it up. So I contour it. That's how I fix it. But again, it all depends on what you present with. Some patients may need a little bit more than others. How long should one wait after gallbladder surgery? Claudia. I would have you wait about 6 to 9 months before you get these body contouring procedures. Simio2, how much is the labiaplasty? Contact us. It depends on everything that we need to do, but definitely contact us. We'll get a little bit more information, and we'll be able to get you some estimates for the labiaplasty. And the labiaplasty is something that I do in the office with you under local anesthesia. The majority of patients do extremely well. We don't need to go under general anesthesia for that. Mariam Garba, how much is a tummy tuck? On average, $13,000, and that includes anesthesia fee, facility fee, and surgeon's fees, as well as all your post-op follow-ups, your pre and post-op kits. Vicky Aisu, can you do only an arm lipo if you don't want a cut, or what do you recommend? It all depends on what you present with. Some patients who have good quality skin but have excess fat, we can do only arm lipo. But if you have a lot of loose skin, you have stretch marks and things like that, I would not recommend doing only lipo to the arms, because you'll have loose skin that you may not be happy with. Now, if you're happy with that and you're fine, you don't want, then that's okay. Like I said, it all depends on the particular patient, but I'll give you as realistic as a result that I can. And I'll paint that picture so that you can see, and I'll also give you my recommendations. All right, there. The surgeon result is okay. Okay, Rima Brown Sugar. Would you recommend lipo or tummy tuck when you have a fupa hanging? With a fupa hanging, it looks like you would need some type of skin excision procedure, so I wouldn't recommend lipo. I would recommend the tummy tuck to help to remove that skin excess, and we can also remove the fat through that. That's what I do for all my patients when I do the drainage tummy tuck. Miss Miha, how long have you been doing cosmetic surgery, and how long have you been in practice in general? So I've been doing cosmetic surgery. I'm a plastic surgeon, so cosmetic surgery is something that I've trained on. I've been doing this since 2016, so it's been 9 years. On top of my standard 6 years of residency training in plastic surgery, I did an extra year of microvascular surgery working at MD Anderson Cancer Center, taking care of complex wounds and patients with cancer and reconstructing their defects. I also have spent an extra year of full training in aesthetics, dedicated to only aesthetics. But plastic surgeons definitely get training in that. But I did an extra year in microvascular surgery and an extra year in cosmetic surgery. So that's what I practice. All right. Thigh lift, do you then? Okay, we've got a lot of questions. Ebony Yvette is asking, do you do? Okay, so here we got a pin question. Tamika love it. I'm 47. Do you think I'm too old for a buttock lift and tummy tuck? No, not at all. So the main thing is not your age, but it's mostly your overall health. I've operated on patients in their 40s, 50s, 60s, and even in their 70s, and they've done very well. Manjusha Birhe, how effective is Renuvion for arms and thighs? It depends on the extent of loose skin that you have. If you have too much loose skin, it's not going to be that effective. The surgery is going to give you the much better results for the skin tightening. Patricia G, what is the post-op care after if, oh, that was too quick. Okay, if you travel from out of state. So usually you'll stay in for about a week. For most of my patients who come in from out of state or out of town or even out of country, you'll typically stay in the Houston area for about a week. Naomi, what are the chances of having complications after the drainless surgery? Very minimal. The drainless technique that I use does not increase your risk compared to the traditional technique. I actually find that it decreases your risk of seroma infection and hematomas compared to the traditional technique. Angela Aguilar, what exactly is a body lift? Body lift is a combination of a drainless tummy tuck, hip lift, and butt lift. So essentially, the scar goes 360 around. It goes all the way around, and it treats the excess skin and looseness that you have in your hip area, your love handles, and your back and the buttock area. So she's got a beautiful, beautiful contour, removed all of that excess skin and excess fat, and the scar goes all the way around, kind of like a belt. That's the body lift. How about high BMI? Pugalicious 2021. So for high BMI, we want you to reduce your BMI to a maximum of 35. All of these procedures, patients qualify with a BMI of max of 35. So we want you to get down to less than that. Patricia G, what kind of tests do you recommend be done prior to trying to get to the rest of that question is hard for me to see. Prior to surgery to make sure our health is top tier. It all depends on your medical history. So we will direct the tests based on that. But as a standard, you will get a CBC and a BMP. But then any other test that we do is based on your particular situation. Knick-knack, does a paniculectomy require drains or can it be drainless? In my hands, I do it drainless. Most surgeons don't do it drainless, but it can definitely be done drainless. That's how I do it. Patricia G, do you offer a mommy makeover? If so, what does that include and how much is that? It all depends. Yes, I do. I offer mommy makeovers and I tailor it to you. Typically, it will include at a minimum a drainless tummy tuck, the fupa area, and then some type of breast surgery. It could be a breast lift or breast reduction, and that will be the minimum. Some patients will want to add like a 360 and a BBL. So we will tailor it based on what your needs are and what your desires are. Sonali, I have hangover skin when I sit, when I stand. Do I need muscle repair or mini tummy tuck? I've answered that question. Thank you. I need to see you to be able to see exactly, determine what you need. Beautiful lady 082. I've had 4 C-sections and my ribs show. I'm big built. So with 4 C-sections, we'd have to see you and see what your excess skin is, what your fat is, and we can determine what procedure is good for you. So definitely come in and see us, putting your information in the bottom left of the screen there. Dom, board certified? Yes, I am board certified by the American Board of Plastic Surgery. So avpplasticsurgery.org, that's the site you want to go to. If you've picked a surgeon, go to that site. There's a big area on the homepage that says, is my plastic surgeon board certified? Click on that, put in the surgeon's name, and if they do not show up, definitely make sure you don't have any typos. Once you've got the correct spelling. If they don't show up, then they're not board certified. Plastic surgeons. Hernandez Barrera, what kind of procedure is it if I just want to get the tummy tuck? If I just want to get my tummy removed, I have too much excess fat. It all depends. It will probably be a tummy tuck. We'd have to see you. We'd have to see you in person. Location, we are in Houston, Texas. So please go ahead and contact us. This is our phone number. The easiest is just to put your information in the bottom left of the screen there. There should be a form. Hello, user long number, diabetic, don't want a sleeve. What can you do for weight loss? For weight loss, you can do the GLP-1 medications. You can increase your activity. You can work on dieting and exercise, and combo with the GLP-1 medications. Those will really help. We've had quite a few patients be very successful with their weight loss. Weight loss. You also have to be very determined, of course. Nikki inspires. Do I have to reposition my belly button? It all depends. The If you're getting a drainless tummy tuck, I mean, you keep your own belly button. I just remove it from the flap where it is. I pull the flap down, and then I poke a hole to bring your own belly button back out. Do you do the country club BBL? I'm not sure what the country club BBL is. Glam smiles. Thank you for your question. There are so many terms out there. I'd have to look it up and see what that is. Patricia G, do you bill insurance for penniculectomy? I do not. So we do not take insurance. All our patients pay out of pocket. So if you want to get a penniculectomy, I would suggest that you contact your insurance, make sure they see if they will actually pay for a penniculectomy, if they will cover it. And then if they do, if they will cover for somebody who's out of network, you will pay us out of pocket, and then you can see if the insurance can reimburse you directly. Skip to Lou. Is it okay to build muscle before a tummy tuck and BBL? Absolutely. Absolutely. We definitely want you to get in shape, definitely before your tummy tuck. Deb Star, is it awake or anesthesia? So in any surgery, you will always get anesthesia. Now, what you're asking is are you awake versus general anesthesia, or awake versus asleep? You will always get anesthesia. We can't cut. It would be assault if we cut you without giving you anesthesia, local anesthesia with you awake. So these procedures, you are asleep. It's going to be under general anesthesia. Millie, I have blood pressure and under medication. Can I do liposuction? Yes, as long as your blood pressure is well controlled. I've operated on patients who have high blood pressure and are controlled with medication and do fine. Ayat Khan, I am 93 kilograms. How much do I need to lose to get a tummy tuck? It all depends, or body lift. It depends on what your height is. So we want your BMI to be no more than 35. So you'd have to calculate your BMI. So based on your height and weight. Brooke Nicole, how are dog ears fixed? Typically, you can fix them under local anesthesia in the office. We inject the area and we just cut it out and close it up. Nikki inspires, how do I get a consultation? Very easily. Putting your information in the bottom left of the screen there, my patient coordinator will reach out to you, text and phone call, and then we'll be able to get you in for your consultation. Or you can also call us 281-724-3138. That's our office phone number during office hours. Nikki inspires, what's the recovery time? So for the body lift, the recovery time is fairly quick. My patients with the drainage technique that I do, you will typically wean off your payments within the first 5 days, 3 to 5 days of surgery. You'll also be walking upright during that time. So by the time you come back to see me 1 week after, you're off your payments, you are walking upright. Some patients will drive themselves into the appointment. Others will have somebody drive them. But it's fairly quick. And then usually you're able to get back to, walking on the treadmill, usually by week 2. And definitely by week 3. And then by week 6, you're back in the gym doing some light resistance training. The Queen, I have loose skin. Can I not do a tummy tuck? It depends on what you present with. We have to take a look. There are other options that we could probably do if you have just a little bit of loose skin. But if you have too much loose skin, we can't do those energy-based devices. We have to do the tummy tuck. At least that would be my recommendation. But I need to see you and examine you to have a better idea of what it looks like. Meeker L, is surgery the only way to get rid of belly fat? No, you can lose weight. Diet and exercise is a way for you to lose belly fat. But that takes a lot longer and it's a lot more of a commitment. Otherwise, yes, you can get it removed with surgery as well. But you can definitely diet and exercise. I have plenty of patients who lose their belly fat by changing their diet, increasing their activity level, and losing the weight. Stashia, BMI requirements. Max BMI is 35. So, for example, give you some max weights. If you're 5'2", your max weight will be 191. If you're 5'4", it will be 204 pounds. The imperfect crafter. Do you have keloid patients? What techniques do you use? If so, I do have patients who say that they're prone to develop keloids. I use the same techniques on everybody because I want to give everybody the best chance of healing. So the techniques that I use are to minimize that tension, to minimize formation of adverse scars and formation of keloids. And I do that in all my patients. Chingo na life one. What if you have a mesh for hernia? Can you? Yes. So I've operated on patients who've had hernia repairs with mesh before, and they've done very well. So if you've had a hernia repair before and you have mesh, that's fine. We can definitely operate on you as well. So contact us, put in your information, and we'll be happy to take care of you. Nikki Inspires. I am not in Texas. Can we do a virtual consultation? Absolutely. For all my patients who are not in Texas or even not in the US, because we do have patients that come in from Canada and outside the US as well and other countries, we will start with a virtual consultation. And even patients who are in Texas, because Texas is huge. I mean, you could be driving 8 hours, 10 hours, 12 hours, you're still in Texas. So we start with virtual consultations for patients who are not in the immediate Houston area or are not able to come in person. We'll start with a virtual consultation. Black Butterfly. Can I get a tummy tuck if I had one C-section and gallbladder removal and VSG? Yes, you can. I've operated on patients who've had multiple C-sections and those types of procedures before. Chigona Life 1, do you suggest lipo or tummy tuck? I have mesh for hernia. It all depends on what you present with. If you've got a lot of excess skin and we need to remove the excess skin, then I would recommend tummy tuck. If you've got good quality skin and excess fat, then we may do just the liposuction. It all depends on what you present with. Once you come in for me to see you, we'll be able to determine which procedure will be best for you. Blessed 1B, can you do a stomach surgery with a previous surgery car incision before? It depends on where your incision is. Yes, I've operated on patients who've had previous belly surgery before and done their tummy tucks. Deborah Jenkins, for you, do you take insurance? No, we do not take insurance. All our patients pay out of pockets. Kenisha, can I do the surgery if I have fibroids? You can, as long as the fibroids are not disturbing you or causing any discomfort or problems. Yes, you can. Otherwise, I'd recommend getting your OBGYN to take care of your fibroids first. But definitely, if they're not bothering you, you can get these surgeries, the body lift or the drainless tummy tuck, if you have fibroids. That's not a problem. Great question. Blessed 1B, what's the difference between a tummy tuck and liposuction? So liposuction removes the fat. It's a cannula that we insert and it removes the fat. So it may leave you with loose skin if you have loose skin. A tummy tuck removes loose skin, fixes the separation of muscles, and repositions your belly button, takes care of the fupa area. So they're very, very different procedures. So one removes fat, the other one takes care of skin, fat, muscles, and all that stuff. Jill Jane 88, can this be covered by insurance? LOL. No, unfortunately, the majority of the procedures that I do are not covered by insurance. And that's the reason why I don't take insurance, at least one of the reasons why I don't take insurance. All of these procedures are considered elective, cosmetic, aesthetic procedures, and insurance doesn't cover them. XOSJ, what about arms? I have lost weight. Congratulations on your weight loss and can't seem to get my arms toned. Okay, yeah, so we may be able to do some procedures for you. We can do some liposuction to that area. And if you got a lot of loose skin, then we can do the arm lift surgery. We can combine those. Come and see us. Colleen, I have had 3 C-sections. Can I still do a surgery? Absolutely. I've operated on patients who've had 3, 4, 5 C-sections. Combination of the vertical C-section and the transverse C-sections and another hysterectomy scar. So definitely we can do that for you. There's going to be a lot of scarring in the abdomen, but I take my time, make sure I remove as much of that scar tissue and give you a beautiful belly. Jill Jane 88, what is a car crash? Was in a car crash, everything hurts. I exercise, eat right, but the belly is a little soft. Okay, so we'll have to examine you and see. If everything hurts, you might still have that pain even after the tummy tuck. Just want you to be aware of that. Jill Jane 88, how's a high lateral tension tummy tuck? High lateral tension tummy tuck, I'd have to look into it. It's a different technique as well. So I'd have to look into that a little bit more to see. Jill Jane 88, how much? I have such a cute tummy, no loose skin. It's taut, just a weird horizontal belly button. Okay, so it all depends on what you present with. I need to see you before I can tell you how much, because I don't know what we're going to be doing. It sounds like you have a flat belly, so you may not need a tummy tuck. I'm not sure. I'd have to see what you present with to be able to determine what procedure needs to be done. Skip to Lou. What's the difference between flank plasty and extended tummy tuck? That's a good question. I'm not sure what. So flank plasty is working on the flanks. Extended tummy tuck is a tummy tuck and an extension into the flanks. So a flank plasty can be incorporated in an extended tummy tuck. If you were to do a flank plasty by itself, then you would just be working on the flank area, so the love handles, or just the love handle area of the flanks. That could be done separately. So, but a flank plasty can be included in an extended tummy tuck. That would be a very quick difference. Blessed 1B. If you do a liposuction after, can you just continue your exercise to tone your stomach muscles? Yes, you can. But if you have separation of your muscles, it's your muscles are not going to come back to their normal position. But you can definitely strengthen your muscles. Absolutely. Easy money. What if I've had 3 C-sections and a lap band surgery? Yes, we can definitely do your tummy tuck surgery. I've operated on patients who've had lap band surgery and multiple C-sections before, and they've done very well. My oldest patients that I operated on, I said earlier on in this Q&A session, she was 72 at the time. She had a lap band, and I did a full body lift, and she did extremely well. And she had previous scars as well. Tony Williams, is the body lift painful? Good question. So the way I do my procedures, I inject the Expro medication and also local around to decrease your level of pain, and also give you pain pills so that you can take that medication. I want your pain level to be no more than a 3 or 4 out of 10, no matter what surgery I do. Even these big surgeries, I want them to be comfortable. I want you to be comfortable. So we treat your pain adequately so that you're comfortable to get through the surgery. Like I said, most of my patients, they typically will wean off the pain meds by day 3. They're not taking any pain meds anymore, which is fantastic. Everybody heals differently, but on average, it's usually 3 to 5 days. By day 3, most of my patients are done. Queen Steph RN, do you do revisions on past surgeries? Yes, I do. Come in and see us. We'll be happy to take a look and see what we can do. All right. It's called Hyla. How long do I have to wait after a hysterectomy before the mommy makeover? I would wait about 6 to 9 months to get your belly to heal well. Use a long number. Age limit. There's no age limit. As long as you're healthy enough, we will proceed with the procedure as long as you're healthy enough. So I operate on patients in their 50s, 60s, and 70s, and they've done very well. Eliz05. How long after Lipo 360 can you perform the tummy tuck? That's a good question. I would wait. I would probably wait about 9 months to a year to get everything to heal in, because there is a period of swelling and coming down of the tissues for you to heal after your Lipo 360. Excuse me. Ivy Hamilton 201. Do you have a payment plan? Yes. So we do offer payment plans as well. We also offer financing. So contact us. Putting your information in the bottom left of the screen there, we will reach out to you and give you the information. Thank you. Blessed 1B, with the ureter reconstructive surgery and C, is it possible, you mean like C-section? Is it possible to do liposuction? I would think so. I mean, you do have some scar tissue, so definitely it puts you at a higher risk, but it should be doable. It all depends on what you present with, like I said. So we have to see you and see if you're a good candidate for liposuction. Miscarried baby. What happens if I get pregnant after the tummy tuck? Typically, if you get pregnant after the tummy tuck, you may need a revision later on, because with pregnancy, your belly will expand naturally to be able to accommodate the baby. So you may need a revision later on. Izzy Fly Gal. I'm not sure if I need a tummy tuck or a paniculectomy. come in and see us. We'll be happy to take care of you. We'll take a look at it and examine you and see what you'll benefit from. As long as your BMI is less than 35, most patients who come in and feel like they want a tummy tuck, a paniculectomy, will qualify for a tummy tuck and get much better results. Tomo, I'm not sure about May or early June. I need possible openings on your calendar. Contact us. Definitely contact us. Linda will be happy to accommodate you. How do you know that you have diastasis? On a lot of patients, you can actually feel it. So when I do the physical exam, I can palpate the edges of your muscles, and I can see how wide they are. And in some patients, it's a lot more obvious than others. Beautifully, beautiful lady. I've had 4 C-sections in my wrist, so I'm a big build. Yes, yes, yes. We've seen that. Definitely come in and see us. We'll be happy to take care of you. Anyone else? Okay. So you guys are getting some of the live that's freezing. Again, that's TikTok, so things can happen. All right. Dulce Younger. What does the mommy makeover include? We tailor it to you. At a minimum, you'll have the drainage tummy tuck and then some type of breast surgery or liposuction and BBL. It all depends. Everybody's different for their mommy makeover, so we will tailor it to what you want to have done. Miscarry baby, does lipo come with a tummy tuck or should that get separate? So the liposuction you can add onto your tummy tuck. Those are two different procedures. So if you want to add it, we can definitely do it at the same time. So you can combine the drainage tummy tuck and lipo 360. And you can also do the fat transfer at the same time. Tony Williams, how is the body lift performed? So I do the scar all the way around. So I fix the hip area, the butt area, and then I also fix the whole front area, so the belly and the mons area. That's how I do the body lift. So you have a scar that ends up nice and low and hidden, and it goes all the way around. Any recommendations after doing a myomectomy? It depends on what you present with. If you've got excess loose skin and fat in your belly area and some sagging of your mons pubis area, then I would recommend a tummy tuck. The drainage tummy tuck technique is what I do, and it will give you very beautiful results. So it all depends on what you present with. Definitely contact us, come in and see us for a consultation, and we'll be happy to examine you and see what procedures will get you what you want. What about cellulite? It depends on where the cellulite is. For example, for this patient, she had some cellulite on the hips and the butt area, and by doing this buttock lift and body lift and hip lift, I was able to actually reduce that cellulite and improve it. So it all depends on where the cellulite is and what exactly are the causes of that. Nikki Benson, please, which country are you in? We're in Houston, Texas. Houston is in the US. We're in the USA. Tomo, if I wanted an endo lift done before the body lift, can that be arranged? Come in and see us. We'll be happy to discuss that and see what needs to be done. Yes, we can rearrange your surgeries, not a problem. All right, guys, I think we're going to be wrapping up shortly. Typically, I do these lives for about an hour. We've been going on for about an hour and 40 minutes, which is fantastic. We've had a lot of questions. I may have missed some of your questions, and I apologize for that, but I definitely appreciate all of your questions and the huge participation tonight. Know that I do these live Q&A sessions every Tuesday and Thursday, time permitting. Usually I start at 7 p.m. Central Standard Time, so Houston time. And I typically will go for about an hour. But if we get a lot of questions and things are very busy, then I'll stay longer. So let's wrap things up. And I hope to see you guys in my office for your consultations or virtually to get you guys in for your procedures. Skip to Lou, is it okay to do a thigh lift and a tummy tuck? Typically, I don't do both at the same time unless the thigh lift is limited to the groin area. In that instance, then I'll combine the tummy tuck and the thigh lift. But if it's a thigh lift that has to go from the groin all the way down to the knee, I will separate those because those are really big procedures, and combining them, I've seen it in my patients, it just demands a little too much on the body to heal. So I want you to be able to heal well and as much as possible enjoy the process. So I typically will separate those two. But like I said, if your tummy tuck, we're doing the drainless tummy tuck, and we're doing the thigh lift that's limited to just the groin area, we can do it together. But come in and see us, or we can do the consultation virtually, and we can just determine which procedures will get you the results that you're wanting to have. Perfect, perfect. Okay, everybody, let's see. We'll take 2 more questions if we have any. Last 2 questions. So we've answered that question by Skip to Lou. Yes, we can do the combination of tummy tuck and the thigh lift only if the thigh lift is confined to the upper groin area. Sassy Peach, how long after a hysterectomy can you do a tummy tuck and BBL? I would wait about nine months, at least 9 months, before we go ahead and proceed with the tummy tuck and BBL after your hysterectomy. We don't make sure your body heals well from that. And contact us, put in your information. We'll be happy to have you come in for your consultation and get you on the books for your surgeries. Last question. Let's do it. And again, like I said, follow us, like Deigni Plastic Surgery. If this is your first time joining us, we do these live Q&A sessions every Tuesday and Thursday, time permitting. And I try to answer as many questions as I can to get you guys all the information that you can get for your body contouring procedures. And we look forward to meeting you in person or virtually, but definitely in person when you come in for your procedures. All right, last question. Who's the last question here? Let's see. Have a good night, Jackie Marie. Thank you very much. I appreciate it. Yes. Okay. So last question will be how long for the recovery for the tummy tuck? That's going to be our last question by Shawanda. Everybody heals differently, but on average, my patients will wean off the pain meds usually within the first 3 to 5 days. They're walking upright within 3 days after surgery. So you're not walking hunched over for 2 weeks. There are no drains. You don't have to worry about stripping them, them getting clogged, emptying them out, and worrying about seromas and things like that. Your recovery is fairly straightforward and quick. You shower, you sponge bathe the day after surgery, sponge bathe the day after surgery, shower starting 2 days after surgery. And then you're back to walking on a treadmill, usually within a week to 2 weeks. You're back in the office, usually during that time as well. You'll come back to see me in person 1 week after your surgery. And by the time you get to about 4 to 6 weeks, you're back in the gym doing some light resistance training. And by 2 months, you're back in the gym with no restrictions whatsoever. So it's a fairly quick recovery. I inject Exparel for all my patients to decrease their pain level. And most of my patients, like I say, will wean off the pain meds usually within 3 days. Everybody's different, but that's typically on average what I see for all of my patients. Thank you very much, everybody. I really appreciate you participating tonight. It's been a wonderful learning experience, I think, for everybody. I really appreciate it. Remember to follow us, like us, and post any comments on any of my videos. I will be answering them either by direct typing the questions in or by doing a video so that everybody can actually learn from and get some value from these questions and the answers. Thank you very much. God bless you and see you next time. I hope to see you in my office for your consultations and your procedures. Bye-bye. See you on Thursday.